but I would think that we should be able to finish our work today at about 16:30 or closer to 1700 hours. Dr. Mdaweni, welcome. Over to you, and you can go straight to your presentation once you introduced your team.
Good afternoon to all the honorable members, and thank you very much, Honorable Chairperson, Dr. Jacobs. Prior to me going into my presentation, I wish to indicate that we also have members of the OHSC board and also the board chairperson, Dr. Kenoshi. At this stage, I would like to just quickly hand over to him to introduce the board members. I will then proceed with the presentation. Thank you.
Yes, before he does, just my apology. I did not note his name, but thank you, Dr. Kenoshi. Welcome.
Good afternoon, Dr. Jacobs, Honorable Chairperson, and good afternoon to the Deputy Minister, Dr. Jomo. Good afternoon to honorable members of the Portfolio Committee, and also to the Department of Health, National Department of Health officials who are with us, but also to the board members of OHSC, but the executive management of OHSC as well, including the CEO, Dr. Mdaweni. Thank you very much, Chairperson, for allowing us this opportunity as Office of Health Standards Compliance to present to the Portfolio Committee the 2023-2024 Annual Performance Plan. And we will go into the presentation immediately after this, but let me also welcome and introduce the board members who managed to join us today, Chair. And we've got Professor Chite, we've got also Professor Chetty, we've got Professor Dudley, we've got Mr. Yawa, Anele Yawa. We also have Mr. Rajesh Mahabir, and we have also Ms. Santo, who are present with us. We have apologies from two other members, Dr. Morar and Ms. Mtunu, Chairperson. So I will hand over to the CEO of the OHSC to do the presentation. She'll be followed by the CFO to do the budget part of the presentation, and we will then take questions from yourselves thereafter, Chair. So we can hand over to the CEO if you're happy, Chair.
Thank you very much, Chair, and to all the board members of OHSC. Once again, good afternoon, and we'd also like to acknowledge the presence of the Deputy Minister of Health, Dr. Dlomo, the management team that is in our midst, even though I will not introduce all of them. We do have the Chief Operations Officer, Dr. Matebula, the executive managers, Ms. Woliko, Dr. Jacobs, and also the CFO, Mr. Mapata, who will assist me with the presentation. We bring to the Health Portfolio Committee the OHSC Annual Performance Plan for 2023-2024, which is informed by the revised medium-term strategic framework. The medium-term strategic framework has a priority 3, which is education, skills, and health. The health component identifies outcomes, including universal health coverage and improved quality of services. Part of the development of the APP looked at our strategic plan for 2020-2025, and all in all for 23-24, we will be monitoring and reporting on 23 annual targets that are in our APP. There's a number of policy mandates as well as legislative mandates that govern the existence of the Office of Health Standard Compliance. Paramount to that is the Constitution of the country, which recognizes healthcare as a fundamental human right, as well as Section 27 of the Bill of Rights, which guarantees everyone the right of access to healthcare services. Amongst the important policies is the National Health Insurance Bill, which we're all aware that it's at an advanced stage, and also the Sendai Framework for Disaster Risk Reduction, which puts the responsibility to government, stakeholders, and private partnerships to come up with strategies for disaster resilience. And we're all aware of the recent public health emergency of COVID-19, which requires that we all work together in mitigating such occurrences. But most importantly, as we do that, we still are certain that there is quality of services that are provided to the users of our health establishments. Part B of our APP, look at the strategic focus. The National Development Plan, Chapter 10, titled Promoting Health, proposes that the OHSC be the responsible entity to ensure that health quality standards are met at every level of care. The National Health Act, as amended in 2013, mentioned the objects of the office as to protect and promote the health and safety of the users of our health services. As the office, we do so by monitoring and enforcing compliance of health standards that are promulgated by the Minister of Health. We also have a responsibility through the Office of the Health Ombudsman to ensure that all the complaints that are received in the office are investigated and are disposed in a timeless manner in alignment with the norms and standards. It is our aspiration as the office to provide consistent, safe, and quality healthcare for all in the regulatory environment in which we operate. As we undertake our activities, we do so independently, impartially, and fearlessly on behalf of all the users of our services. As the OHSC team, we subscribe to a number of values, which also informs the work that we do as a regulator, that we want each and every human being to be treated as an individual. So human dignity is quite important. We want to remain accountable to all our activities and also the expenditure of the budget that we receive. As we release our work and findings, we want to do so in a transparent manner. And indeed, we want at some point to have the quality of services improved such that each and every person that provides services should do so at the right time and do the right thing and to the right person. Safety and integrity is also very important to us. As a regulator in the healthcare sphere, there are desired outcomes and impacts that we would like to see in the healthcare sector. The Office of Health Standard Compliance would be comfortable that we are achieving our goal as it is described in the mandate once we start to see the reduction in avoidable mortality and morbidity and also harm in all our health establishments. We also wish that through the work that we do, there is improvement in the availability and responsiveness, as well as the acceptability of the health services that are provided to all the users, so that in the end, we improve the patient or the user experience with our services. Therefore, we'll contribute to enhancing universal access to the quality of services. This is a very important slide in that it does talk to the link between the Office of Health Standard Compliance and the National Health Insurance. We take the work that we do as the gateway towards accessing the National Health Insurance Fund, meaning that each and every health establishment that would wish to participate in the NHI fund, once we have the act, it would have to be certified as compliant with the norms and regulations by the Office of Health Standard Compliance. This put a mammoth task on our shoulders because we understand and we accept the enormity of the work that lies ahead in ascertaining that we are able to inspect all the health establishment in the country, not only in the public sector, but also in the private sector, particularly those that would want to participate in the NHI fund. Whilst as the office, we recognize this important task, it is important that we highlight to the honorable members that in terms of the fieldwork and the systems, as the office, we are continuously working towards being ready for the NHI. However, it is also critical that we highlight to the honorable members that it would all be dependent on the resources that are allocated to the Office of Health Standard Compliance so that we're able to reach this desired outcome and effect. The overall organizational structure, without going into the details, we have a board that provides oversight to all our activities. We also have the Health Ombud located within the Office of Health Standard Compliance, and the Health Ombud reports directly to the Minister of Health, with the Health Portfolio Committee providing oversight. I will, in the next couple of slides, go through the programs that are on the right-hand side of the slide. Looking at Part C of the APP, this is where we start looking at our performance and also how we measure it. In our 2020-2025 strategic plan, we have structured the objectives into 5 outcomes that are aligned to the MTSF of 2019-2024. These 5 outcomes are mapped against an impact statement of safe and quality healthcare services. Linked to these outcomes are a number of indicators, which we're going to go through them now. We must highlight that the 2020-2025 strategic plan had other outcomes which related to the establishment of an office, a regulatory office as it stands today. Therefore, with the next strategic plan, we'll start to look more at the outcomes which the majority will relate to the provision of healthcare quality and safety in the services. Now, looking at the programs, the first one, administration, where we have human resources, information, communication and technology, finance and community and stakeholder relations. This is a program that provides support and administrative leadership to all the implementing programs of the OHSC. These slides will look at what we have put in our 5-year strategic plan, which is the column, the second column, and we'll also look briefly at our progress and progress performance for the past 3 years. 2020, 2021, 2022 will be the audited performance. We're still awaiting the audit, which is about to commence for 2022, 2023, with a focus of 23, 24, where we then indicate what we have put in our APP. The first indicator, the percentage of vacancies filled within 4 months of the vacancy existing. Here we wanted to measure the time period within which we're able to fill vacancies so that we do not experience disruptions in our work. From 2020 to 2022-23, we are now standing at 67%. The performance was a bit low for the past 2 years. However, I must mention that although we are at 67%, at the end of each and every financial year, we do actually have a very low vacancy rate, but this would measure the time period within which we fill the vacancies. For the 2023-24 APP, we've put a target of 91%, meaning that we would like to fill these vacancies within at least a period of 4 months. The next indicator, which is new, we started to report on it the outgone financial year. That is the overall vacancy rate per year. we are standing at 5% overall. Of the 129 funded posts, 123 have been filled. And for the 2023-24 APP, we've put a target of 6%. We also monitor the training of the inspectors. We are supposed to train all inspectors and certify them as being competent to undertake the regulatory work of the OHSC. We have all our inspectors at the moment are trained. They go through quite a comprehensive training module, and we were assisted by a tertiary institution. We also monitor the availability of the information, communication, and technology services. And the reason why we monitored these indicators for core services and for the general office support is because 2 years ago, we migrated from the Medical Research Council to a new building. It was then important for us to establish the ICT infrastructure and monitor its availability. However, these are some of the indicators that might fall off in the next strategic plan. For 23-24, we've put a target of 95%. It's quite important that we engage with various stakeholders in the community and in other sectors, also in our health institutions and other tertiary and private institutions, where we raise awareness on the work of the Office of Health Standard Compliance, as well as the Health Ombud. That indicator on community stakeholder engagements was more of those that we have done in the public sector, where for the 5-year period, we have a target of 60. We have been able to reach this target. For 22-23, we have conducted 34 of these, including the national board roadshows, which were undertaken by the OHSC board. For 23-24, we've put a target of 12 of these in the public sector. We do recognize that we were advised at some point by the Health Portfolio Committee that we need to target the rural areas. And we do, in fact, confirm that most of our work, we do try to reach out to the rural areas. And we also do some live broadcast through the community radio stations so that the work of the office can then reach out to all sectors of our society. The next indicator are the engagements that we conduct in the private sector. Overall, for the 5-year period, we'd like to conduct 40 of these. We were able to surpass the target for 22-23, and we've put a target of 8 in 23-24. I must indicate that with these engagements, we're also informed by some of the requests that we receive from our stakeholders and the collaboration with other regulatory entities, so that when we go out to communities, we do explain the various regulatory functions of other entities, including the OHSC. We are happy to report to the honorable members that over the 7-year period, the OHSC has consistently achieved an unqualified audit opinion from the external AG audit. We do wish to maintain this track record, and even for 23-24. Looking at the next program, which is program 2, this is the largest program in the OHSC. This is where the inspectors are located, and this is where we also facilitate the inspections that we conduct in the healthcare sector. We then monitor the number of inspections that we conduct in our health establishments in all the 9 provinces. So the first indicator, the inspections in the public sector, we've pretty much been able to reach this target over the years. For 23-24, we've put a target of 689. The denominator of 3,741 health establishments, this is what we have in our OHSC database. I must hasten to mention that the coverage which we need to reach is far much more than the 3,741. We already are aware that the National Department of Health has close to 50,000 facilities. It is then important to highlight that when we look at the NHI and what we have to do in terms of inspecting the health establishment, it's then going to be quite critical that there is definitely additional resources that we're able to receive so that we can expand our inspection coverage, not only in the public sector, but also in the private sector. What informs the targets that we put is really the funding envelope that we receive on an annual basis. The next target is inspections that we conduct in the private sector. Many times when we came to the head portfolio committee, the honorable members asked us, when is the OHSC going to start inspecting the private sector? We're pleased to report that we started towards the latter part of 2023. We were able to conduct 51 of the 431 private sector or private hospital groups which we had at that point in time. For 23-24, we would like to conduct 100 of these inspections, and with the denominator of 526 of these private hospital groups. Indeed, as much as we would like to inspect more, as I've indicated, this is dependent on what we currently have in terms of resources. Now, once we've conducted the initial inspection, which we call a routine inspection, there are two outcomes to an inspection. It would be either we determine that the health establishment complies with the norms and standards, or it does not comply with the norms and standards. When there is compliance, we then issue what we call a compliance certificate. When there's non-compliance, we then schedule a re-inspection, which we call an additional inspection. And this, the next target, the third row, that's what we then track and monitor. So for 23-24, we've put 100%, and over the 5-year period, we've always said we'd like to conduct all the re-inspections. The reason why we put 100% is that when we have determined that a health institution is non-compliant with the norms and standards, it's quite important for us to go back to re-inspect, which is why we then put 100% as a target for the re-inspections. Once we have conducted these inspections, we are required to report biannually on all those health establishments that have been inspected, and the provinces and the numbers and the status of compliance. And twice a year, in 23-24, we'll also biannually report on all the institutions that we have inspected. The next indicator then refers to the overall annual inspection report, where at the end of the financial year, we then compile a report, we then triangulate and analyze the trends, and are able to inform the country or the healthcare sector on the compliance status and the quality assurance issues that emanated for our inspection findings. And this is the report that we release once a year. This slide just provides an overview of the inspections over time. Starting from 2018-19, we started to have the regulations in 2019-20. Members would note that in 2020-2021, we took a dip, almost 50% inspections conducted, and this mainly was as a result of the funds that were available at that point in time. Over the years 2021, 2022, 2023, realizing some of our challenges, we have undertaken some internal efficiency measures such that we're able to stretch the resources that we have, and we've been able to increase the inspections to 544, 781, and 689. It's important to indicate to the members that internally we do have the OHSC business case, which it's almost a framework of what needs to happen in the next 5 years in terms of expanding our inspection footprint in the whole country, as well as how do we then conduct our work, including a decentralization model approach, such that we do have the OHSC located in various regions in the country or even in provinces. However, it is important to indicate that the implementation of the OHSC business case and some of the approaches and models that we're working on internally will be solely dependent on how resourced we are. The next slide is an overview of the private sector inspections, a total of 51. We then give a breakdown of the provinces as well as the various private hospital groups which were inspected. We need to mention that the work of the OHSC is well received in the private sector, and we have experienced cooperation from them. With the public sector, we've been conducting these inspections over a number of years. So in the main, there is familiarity with the regulatory environment of the OHSC. The next program, complaints management and the health ombud. This is where the complaints are received. They are investigated for non-compliance with the prescribed norms and standards, and reports are then issued. In the main, we have not been doing fairly good with this program, largely because of a shortage of human resources. If we look at the indicators that we monitor, the first two, the percentage of low-risk complaints that are resolved within 25 working days, these are complaints that are usually disposed of at the call center by the team in interacting and collaborating with the health establishment. In the main, we've been on the green here, and we've put a target of 85%. The next target, the indicator, will be those complaints that we resolve through the assessment unit within 30 working days. And for the first time in 2023, we have reached the target and even surpassed it. However, I must indicate that in the outer years, it was difficult to do so because of the shortage of staff, but we've been able to assist this program by getting contractual appointments, which were able to assist the team. And for 23-24, we've put a target of 70%. We've experienced challenges with the next three targets. These are complaints that are more, they're high risk, and they're also medium risk. These are complaints that take a longer period to resolve, simply because one complaint may involve a number of health institutions, a number of service providers. The investigators might have to travel to these institutions several times, and also to reach out to their complainants. And we're also dependent on the turnaround time of the health institutions once certain information is requested by the Program 3 or the Program 3 team. So the percentage of those that are resolved within 6 months, 12 months, and 18 months, as members can see, the performance has not been very good. For 23-24, we have put for those resolved within 6 months a target of 20%. And the next two targets in our strategic plan, we have the percentage of complaints resolved within 12 months and those resolved within 18 months. For the 2023-24 APP, we have slightly adjusted these indicators, and this is based on our operational experience in the resolution of these cases. So we now have the percentage of complaints that are resolved within 24 months through investigation, where we have a target of 5%. And this has always been the concern of the board in terms of the resolution of these complaints. And the advice was that we need to look at the backlog of cases more like a project, which is why we have the indicator of the percentage of backlog complaints that are older than 24 months. And we've put a target of 2%. Perhaps I need to indicate now the target of 2%. At that stage, we were only having the staff complement that the program had at that point in time. But we need to indicate that we've just recently appointed through surplus funds 5 more investigators. So we do expect that there will be an improvement even in the 2% in the backlog of cases. However, these are contractual appointments for only 1 year. The next program, this is where the standards are developed, where we analyze the data, and where we also look at all our findings, triangulate the information, and conduct research that will seek to inform on quality assurance issues in the provinces and also at national level. We track 2 indicators, the first one being the number of recommendations for improvement in the healthcare sector that are made to the relevant authorities. It could be a province, it could be a private hospital group, it could be at a national level. Now, over the 5-year period, we've put a target of 15. We've been consistently been able to produce 3 reports over the financial years. And for 23-24, we've also put a target of 3. I must clarify that although it might look like it's a small target of 3, but the work that is involved in actually developing one of these reports takes almost a number of months. And let me give an example. We would first have to conduct inspections in a province and complete all those inspections and be able to analyze the data and be able to make comparisons with all other data or information that we have. So in the main, these reports, others will take 6 months to complete, others will take up to a year. A report on the annual returns, which is one of the reports that we share here. This report, we would wait for all the health establishments to submit to us their individual health establishment profiles, and only then we'll be able to then collate the data and information and analyze it. We also provide guidance workshops on the norms and standards as well as the tools. This is quite critical so that people and also the health establishments that we inspect, they are familiar with the tools and they know what to expect when we come and visit them as a regulator to determine the compliance with the norms and standards. And for 23-24, we've put a target of 24 of these guidance workshops. Maybe just to provide a general update on the inspection tools, the OHSC adopted a progressive and incremental approach in the development of tools with a clear focus of starting with tools in the primary healthcare setting. To date, we have completed a number of tools that are in use. We've got the clinic inspection tool, the community health center inspection tool, the district and regional hospital inspection tool. We also have the private acute hospital inspection tool. We are currently at the tail end of finalizing the central hospital as well as the provincial tertiary hospital tools. The development of tools is actually a science on its own, and it's quite a comprehensive process which requires lengthy consultations with various stakeholders and a clear understanding of the service delivery platform, so that whatever we put as measures and evidence which we are going to look for, we have determined that it does exist at service delivery level. We are currently busy with the general practice inspection tool. The OHSC is conducting consultations with the wider general practice community. We have gone through the process of the initial drafts where we consulted with all the various formations of the general practitioners in the country, and we're able to get input from them. And we're at the last stage where we are consulting with the GPs in the provinces, and thereafter we'll hold a national workshop where we'll then come with the final draft tool. At some point, we reported to the committee that we have developed the emergency medical services norms and standards, which were then submitted by the board to the national minister. In December of 2022, the minister promulgated the regulations for emergency medical services, and we've just recently commenced with the development of the inspection tool for emergency medical services. Maybe just to bring this point across is that for the general practice tool and the EMS tool, as much as we'll be able to complete these tools at some point, it's important to indicate that when we look at the current inspectorate staff complement. We would not be able to start immediately with these inspections until we do get more or additional inspectors to conduct these inspections. The last program, certification and enforcement. This is a program that facilitates the issuing of the compliance certificates to those health establishments that are compliant, and also take enforcement action in those health establishments that are persistently non-compliant. I need to clarify that the approach of the OHSC is not punitive in nature, it is progressive. So enforcement action is taken when we have established that there is persistent non-compliance with the norms and standards. It would then mean we would have conducted a re-inspection and determined that there actually has not been any change in those norms and standards that were breached by the health establishment. We've also started a process of conducting and meeting with the various provinces. What we call this the pre-enforcement hearings, where we will take the various health establishments on some of these breaches in the norms and standards so that they understand what is then to follow next. The indicators that we monitor in this program, the first one is the percentage of health establishments that are issued with a certificate of compliance within 15 days. And for 23-24, we have a target of 100%, which is the same over the years. And the rationale here is that once a health establishment is compliant, it should and it must be issued with a compliance certificate, and that should be within 15 days from the date of the final inspection report. The next indicator is will then monitor the enforcement action that we take, and we want to do this within 10 days from the date of the final additional or re-inspection. And once again here, we have a target of 100%, because where we have to take enforcement action, we want to do so. We must report to the Health Portfolio Committee that we've started with the enforcement action in 2022-23 in a form of writing warning letters to the health establishments. And we have actually seen a positive response from those health establishments where they start to interact with the office and also remedy some of those breaches. Once again, we need to then produce biannually a report that will then detail or give details of the health establishments where we have taken enforcement action and where we have then also issued compliance certificates. This is just a depiction of the compliance certificates that have been issued in the past financial years, 2021-22 and 2022-2023. Overall, the compliance rate is very low, with 440 compliance certificates issued, and we also give the provincial breakdown. And the provinces that have more compliance certificates that have been issued would be KwaZulu-Natal and Gauteng province. Now, looking into the future, as the OHSC, we would wish to see more compliance certificates being issued, because then that would give us the assurance, or at least the level of comfort, that health establishments are complying with the health norms and standards. This can only happen when the overall inspections are then increased, so that we increase the compliance certificates. Of course, the caveat there is that there must be compliance with the regulations. But also, most importantly, which is what we emphasize when we interact with the provinces, when we issue our findings, is that once we have released inspection findings to health establishments, the districts and the provinces need to take this information, and it must find its way in the overall quality improvement plans of a particular province and of a particular district, so that at some point we can have this being part of the system, the continuous quality improvement. Because when we come as the OHSC, we come on a particular date, we spend a specified number of hours in the health establishment, and thereafter we leave as a regulator. But most importantly, there should be sustainability in terms of working on those bridges on the norms and standards. At this stage, Honorable Chair, I would like to request my colleague, Mr. Mapata, to take the presentation further.
Thanks, CEO. Good afternoon to the Honorable Chairperson, Dr. Jacobs, all the honorable members of the Portfolio Committee, the OHSC Chairperson, Dr. Kinoshin, and all board members and colleagues in the OHSC. I will take the members through the salient features of the budget as indicated on the screen. For 2023-24, the budget is 162 million, as indicated there. Our preliminary expenditure for 2022-23, the year that just came to an end in March, the 31st of March, indicated that our preliminary expenditure was 192 million. So the budget of 162 million is at least 30 million less than what we had spent in the prior year. And it goes on to 181 million in the outer year of the MTF period 2025-26. Next slide, please. On this slide, we just indicate the average percentage increases in the budget, that the 2023-24 budget has increased by 3.3% when compared to 2022-23 financial year. And over the MTF period, these 3 years, the average increase is about 5% of the budget. Thank you. Next slide. This slide indicates that the highest allocation has gone to the compliance inspector unit, which is the biggest unit in the OHSC in terms of even staffing and its operations. Next slide. When we look at the split between core and support functions, 57% of the budget on average goes to the core functions of the OHSC. And the next slide indicates how we have allocated the core functions, which are inspectorate, certification enforcement, complaints management, and standards design. The support functions is board and governance issues, finance and supply chain, human resource management, IT, communications and stakeholder relations, legal services, as well as facilities management. Next slide, please. In terms of employee distribution, the compliance inspectorate makes up 42% of the total number of staff in the OHSC. So it's the biggest program, even in terms of staffing. Next slide, please. And when we look at the distribution of employees on a core versus support functions basis, the core functions make up 71% of the total staff numbers, and 29% are in the support functions. Next slide. In terms of economic classification, on average, 65% of the expenditure budget allocation goes to compensation of employees, with 30% on goods and services. Board cost make up only 1%, capital expenditure is 2%. So most of the expenditure, given the nature of the work that we do that relies on human resources, 65% of that goes to a compensation of employees. Next slide, please. As I've indicated, on average, the budget increases by 5% to take care of inspections, standard design, resolution of complaints, as well as the necessary administrative support required across the organization. And the next slide. On this slide, we just want to indicate to the members that we have added only 2 positions to the 2022-23 staff complement. So the staff complement increases from 129 to 131. That is the funded posts that we are referring to here. Next slide, please. And we have also indicated the areas of concern that we have noted In terms of the OHSC's policies, the salaries are exactly the same as those that are offered in public service, offered through DPSA. When we did the budget, it was based on the, I see there's a hand, Chairperson.
Yes, can I just see, Honorable Gela? Honorable Gela, I see your hand raised. I couldn't see your hand on the platform because I was watching the presentation.
Yeah, you can just note my hand for questions.
Thank you, Honorable Gela. Yes, how far do we still have to go?
This is the last slide, Chairperson.
Thank you.
Thank you. The cost of living adjustments is one
Please
area of
continue.
concern that. Yes, thank you. The cost of living adjustments, which we didn't budget for, but we have noted that recently government and the labor unions have agreed on 7.5%, and that is something that will have to be factored into the OHSC as well. And the extent of inspection coverage not matched by available resources. And when it comes to re-inspections, at the time of planning, we don't know the location and type of facilities that will be re-inspected, because this will only be known during the course of the year when the re-inspections are being conducted. The CEO has already alluded to the issue of decentralization, the limited resources in terms of expansion, and we also have unpredictable costs such as legal fees that may arise depending on what the findings, for example, in terms of complaints investigations say. So members are at liberty and allowed in terms of the Act to lodge appeals. So those are unpredictable costs that at the time of planning we don't have an idea of. The next slide, please. I think this was the last slide. Thank you, Honorable Chairperson. Thank you, CEO.
Thank you very much, Mr. Mapata, and thank you, Honorable Chair.
Thank you very much, CEO. Is that the last?
Yes, Chair, it was the last slide. We are done. Thank you.
Thank you very much. Any word from your chairperson of the board?
Yes, thank you very much, Chair. I think that was a presentation by the executive team on the APP, and I think we can await any questions or discussions from yourself, Chair, and honorable members. Thank you very much.
Thank you for the presentation. It was really good to listen to you. I have 3 hands so far. Honorable members Gela, Clark, Wilson. Anyone else? Chirwa? In that order?
Thank you very much, Chair. Let me welcome the presentation from OHSC and also congratulate them on their clean audit, Chairperson, as they have achieved a clean audit. But also, Chair, to congratulate and welcome the new board members led by the chairperson, Dr. Ernest, chairperson. Chair, coming to the questions that I want to ask chairperson. One, under progress on outcome 3, most targets have not been met and the problem is not on track. Can the OHSC provide information on what is the outcomes, chairperson? Then my second, Chair.
Honorable Gela, can you repeat that question? We lost you somewhere.
Okay, Chair. Do you hear me, Chair, now? Chair. Chair.
I can hear Honorable Geller.
Okay.
Oh, I think there's my network that's unstable now. Can you hear me?
Yes, Chair, I can hear you.
All right, just go ahead if the others can hear you. Thanks.
Okay, should I repeat the question or should I proceed with my other question?
I think they heard you. It's fine. Just continue with your next question.
Okay, and Chair, the program under program 2, if they can also tell us the percentage of public health facilities be inspected for the compliance will decrease from 21% in 2023-2024 financial year to 18.4% of the MTEF period. Is there a particular reasons for the reduced targets for the public health facilities over the MTEF? The other question, Chairperson, is that if we can get a clarity from the OHSC regarding whether they have done they have assessed the impact of the unrest, the recent labor unrest on the public health care facility, in particular, if they can HOS share with us their findings, Chairperson. Lastly, Chair, it's regarding the roadshows, Chairperson, if they can also share with the committee on the roadshows that they have undertook between September and November 2022 in public and private health sectors. Thank you, Chairperson.
Thank you. I'm not
Thank you,
following the
Chairperson.
order. Clark, Wilson, Chirwa, Kaba.
Thank you, Chairperson. Member Gela has mentioned the decrease of the targets in terms of the public health facilities between 2023 and 2024, down to 18.4%. That would be appreciated, as well as the unrest that what impact that had. So that was mentioned. And then if you could also just tell me how many ideal clinics has the OHSC inspected and certified during 2021-22 and 22-23 financial year. Also, has the OHSC got enough funding and resources available in order to ensure that all health facilities comply to the required NHI requirements and the ideal clinic document? If they could tell us, please, when would all the vacancies be filled and why has this target not been met? And of the re-inspections because of initial non-compliance, what percentage of facilities do now comply? And what percentage of facilities inspected the past financial year complied? And how long do the facilities have to achieve compliance if they initially failed? And then the slide where it said that you had inspected 51 of the private hospitals during this period, could you please tell us how many of those hospitals did not comply? And if you could also just tell us which of the provinces are the biggest transgressors in terms of non-compliance. If you could please explain the low number of complaints resolved after 6 months and more. I think to a certain extent you did answer that to say that the legal processes take a long time. But if you could elaborate on that. And then how much money would the OHSC need to fulfill its mandate? Thank you, Chairperson.
Thank you, Chairperson, and thanks to Chair Kanoshi and his team for the presentation. I have some concerns. So you start out by telling us that, basically your job is to monitor, enforce compliance by health establishments, ensuring consideration, investigation, and disposal of complaints, and to ensure safe and quality healthcare for all. Now, your visions and your values and your mission are laudable, that we accept. However, we are not seeing this. Absolutely not at all. Universal healthcare is there. There is nothing stopping any person in this country going to any public facility to access healthcare. So the universal health coverage is there. What they are not getting is quality healthcare. In fact, quality healthcare is the word quality does not exist. They might get healthcare quality, they do not. And you know, this is very concerning. What it also doesn't take into account, and because the quality of healthcare is so bad, because facilities are so badly managed, because facilities are not maintained, because they are under-resourced, we are now running into over 100 billion rands of medico-legal claims. Whether they are manufactured claims or whether they are real claims, the fact doesn't change that those claims are on the table. And because of maladministration, record keeping, and all of that kind of stuff, claims are being won, whether they're manufactured or not. They are being won, which is causing chaos in the health sector. And as a result of those, we're seeing the quality of healthcare disappear down the tubes. So that is a concern. So the quality does not exist. Now, this is an area where you are not entirely, but where you are held accountable, because it is your job to ensure that these kind of quality services are delivered. And quite simply, they are not. You talk about the certification of compliance with regulated standards, and these being a prerequisite for the NHI. Well, we have a problem, because it would appear very few are actually compliant, and many, and I can tell you this off the top of my head because we do these kind of oversights, are not going to be compliant anytime soon. Not only are you, the OHC, under-resourced, the health facilities are under-resourced too. So can you give us some idea exactly how we're going to implement the NHI if nobody is going to be compliant? Because quite simply, they are not. You've talked about the issuing of certificates. KZN is particularly high. I don't know why they are so much higher than the rest. But, you know, it's one thing to issue a certificate to maintain that compliance and to deliver quality healthcare is something else entirely. In your outcomes 3, you talk about the improved quality healthcare services rendered to the users of health establishments. And it's very concerning that when we talk about progress on outcomes or quality, that it's not on track. It's not on track. It's not on track. Well, we could have told you that. We go out there, we can see that. The fact remains is, how is this situation going to change? You're talking about a 5% improvement on your budgets year on year. Well, I mean, the cost of living alone has rocketed way beyond 5%. The demands by your labor unions, etc., are exceeding 5%. So I think the biggest concern we have here, and I'm addressing this not just to you, but to the Health Portfolio Committee as a whole, that until such time as proper budgeting is given to a very critical component like the OHSC, we can put NHI completely off the table. It's not going to happen. It cannot happen. People are not compliant. Facilities are not available. And the NHI quite simply is not going to change that. Certainly not anytime soon, because until such time as money is spent on ensuring quality healthcare, the facilities are not going to become compliant. You talked about the status of the inspection tools, both on EMS and on health services. When will this be finalized? EMS in this country is an absolute shambles at the moment, under-resourced, understaffed, and all of those kind of things. So draft is not helping us at the moment. We need these documents finalized and some action to be taken there. I think overall, I think the biggest concern here, and I think the reality is, in terms of your areas of concern, is that it's cost versus realistic budgets, and your budgets quite simply are not realistic. Certainly as far as the health ombudsman is concerned, not only is he understaffed, he's under-resourced. The problem is, as long as this continues, we're going to see an escalation in medico-legal claims, whether real or whether manufactured, until such time as our health facilities become compliant and deliver health services of a reasonable standard and some degree of quality. This is going to continue, and it is going to put the health facilities under further and further and further pressure. Thank you, Chair.
Thank you very much, Chairperson, and greetings to the OHSC. Thank you very much also for your presentation. I only have 2 questions. I want to find out what the long-term plan of the OHSC is in increasing human resource, because you're citing it as an issue, and it's a recurring issue over the years. And lastly, I want to know which facilities have raised the most concern for the OHSC in the past year, in terms of the status of the facility, and subsequently addressing or implementing recommendations that are given by the OHSC. If you can just outline these facilities for the portfolio committee, I think it will be really helpful in also doing our oversight work. Thank you very much, Chairperson.
Thank you. Honorable Kaba.
Thank you, Chair. Chair, I think
Honorable Kaba.
Yes, can you hear me, Chair? Hello?
I can hear you well. Please continue.
Yes, I think I'm joining Honorable Gela on welcoming the presentation, and also indeed requesting that they share with us the roadshows experiences and so on. But important, Chair, to mention
Whatsoever.
yeah, and then, Chair, important to mention is that the 2 concluding presentation slides were not indicative of the projected or the estimate of amounts that could be a necessity factor, even though members are eligible to claim. So I just wanted to understand if are there any available projections. But however, Chair, we are confident of their work, and we welcome the board. We remain ready to work with them. Thank you, Chair.
Thank you very much, honorable members, for those questions and concerns which you had raised. Thank you very much for the presentation, Dr. Daweni and your team. To the board for coming to this presentation. Very important work that we must do as a portfolio committee on health to ensure that there are budgets for the work that has to be done. Now, I only have 2 or 3 points I want to maybe raise with you. Your most important job, as I understand it, would be to go and do evaluations of the compliance of facilities, whether they be in the private space or the public space, and to ensure that they are in a position to be able to render the services which are required. So I would have thought that there may be two programs, really program 2 and program 5 would be your most important programs, but I do see that even though the bulk of your funding is allocated to program 2, which is Cloud Compliance Inspectorate, there seems to be a proposal of a decrease of about 1.25% in the 2023-2024 financial year. And maybe you'll be able to explain that, considering the fact that you are intending to increase your inspections to the private facilities. Having said that, I also note that you have actually intending to decrease your inspections to the public health facilities and increase from I want to get the total increase with the private. I think it's decrease from 21% to 18.4%. It was mentioned by Honorable Gela. And I think increase your inspections to the, I just need to find that page quickly. Private facilities from 0% to 21%. That's quite dramatic, and I would like to maybe get an explanation from you why you would want to decrease the one and increase the other so much, and whether it's just an exchange. What's the real challenge? And I did note when the budget was presented, it was said that the inspections are really not matched by the available resources. Maybe you can explain what that sentence really means. And then secondly, in terms of your training of the inspectors, I am trying to understand if you say assisted by a tertiary education, whether that is now a certificate, a diploma, how much weight does it really bear? Is the TAQA accredited, etc.? And can those inspectors use this to advance their own careers, or is it a short course of 3 months, 6 weeks that enables them to maybe just things when they do inspect facilities? And then very lastly, in terms of your strategy to monitor and manage the issue of the unknown number of facilities due for re-inspection, whether you have a strategy for that, what that strategy is, and also still on inspections, whether you can do management of related data on inspections of facilities, what your intention is to be able to do that. I think those are the last questions which we're going to raise to you. Thank you very much. We look forward to hearing your responses.
Thank you very much, Chair. I think we will share as a team, the responses to the questions raised by the Chair and the honorable members. Maybe I will take the one on the road shows by the board and the executive managers within OHSC. First of all, these roadshows were made last year, 2022 calendar year, from September until November. They were the first by the board to be done, and each team consisted of 2 to 3 board members. And it also each team had also 2 to 3 executive managers who were accompanying the board members. We targeted all 9 provinces, departments of health, the provincial departments of health, and we managed to reach all of them. So appointments were made with the heads of departments, and we met them with their senior management, each one of them. We also had about 5 private hospital sector groupings and companies that we visited, and we've got a list of those. The purpose was, first of all, to re-familiarize the heads of departments and with their teams, but also the private sector about the OHSC, the work of the OHSC, the mandate to improve safety and clinical safety and quality of healthcare of the people of South Africa, but also how the OHSC works, how the tools that are used to inspect and the health establishments to ensure compliance, but also we shared with the provincial departments the performance of their health establishments in the previous 2 years, those establishments that had been inspected, those that had complied, those that had not complied. So we shared all the information and data with them. It was the first time that the OHSC has done this, and I think the board and the executive managers, including the CEO, have made an intention to do this on an annual basis. The responses, I think, that we received, the feedback from the provincial departments was very positive. I think there was reawakening of the awareness of the importance and centrality of the OHSC to the health system in the country, but also the role that the OHSC will play in the establishment, in the implementation and the rollout of NHI when it comes. And I think it was quite a positive feedback, Chair and members. I think this question was asked by Member Gela and Member Clara. Thank you very much. I'll hand over a chair to Dr. Mdaweni to assist with responses to the other questions. Over to you, Dr. Mdaweni.
Thank you very much, Chair, and thanks to the honorable members for the questions as well as the comments provided. I will respond to some of the questions and thereafter request my colleagues to assist with some. Honorable Gela, we admit that Program 3, we are not doing very well in terms of achieving the targets and also looking at the overall performance from 5 years from the strategic planning in 2020. However, it is important that we note that for the past 2 years, at least for the low risk complaints, you know, the ones that are supposed to be resolved within 25 days and 30 working days. Over the years, we've been in the red, but we have seen some improvements in the last 2 years. And that was as a result of some of the staff that we're able to allocate to Program 3 through some of the savings which we're able to achieve in some of the programs. And also during the COVID-19 situation, there wasn't a lot of travel. So some of those resources were able to then redirect to assist in this program through contractual appointments. Now, we do foresee that going into the outer years of the MTF period, if the staff complement remain as it is, definitely we're going to have a challenge with these targets. Let us also indicate that with the release of the Health Ombuds reports, starting with Life Esidimeni in 2018, the office experienced just an upsurge of complaints that were sent to the office because people were now aware of the work of the office and particularly the Ombuds. Having said this, the mitigating factors that we've put in place, as I've mentioned earlier, that we've just recently appointed 5 investigators. They've just barely started their employment, and we hope that we should be able to deal with some of the backlog complaints cases. However, it is only fair that we admit that this is definitely a concern to us. Now, Program 2, the reduction in the targets for public sector inspections to 689 in 23-24. Now, all along, we've been mainly inspecting the public sector institutions. Now, from 2022, we then started in the private sector. Now, we still have the limited funds, so we had to allocate some funds to conduct inspections in the private sector. It's for that reason we have 689, which is the decrease that honorable members referred to from 21% to 18.4%, so that we can accommodate inspections in the private sector. The risk we wouldn't want to have is that we end up only inspecting the public sector, more so that now we do have the tools to inspect the private sector. Overall, there's definitely a need to increase the inspection coverage for the OHSC, and that cannot be done with the current staff complement. If you consider that the Act says we should inspect a health establishment once every 4 years, and if we look at our numbers, they're actually a far cry in respect of what we need to actually achieve. So what are the other mitigating factors that we've done internally? We have what I've referred to as the OHSC business plan, where we have actually detailed how we'd be able to increase the inspections. And however, it's all dependent on whether we're able to get additional inspectors to undertake this work. The other question from Honorable Geller was the clarity on whether the labor unrest, whether we're able to assess the impact of the labor unrest. We were also affected by the labor unrest in that in some of the provinces would only discover upon our arrival that there are unrest, and teams had to go back and not be able to conduct inspections. And unfortunately, at some point, some of the inspectorate teams were even held hostage during this labor unrest. So how we've dealt with them, we have not been out to assess the impacts thereof. However, we've dealt with all those cases that were referred to us through the early warning system if there were reports which were sent to the office, and others were sent in a form of complaints to Program 3, the Office of the Health Ombudsman. However, in terms of assessing the actual impact, we have not been able to do so. Honorable Clark also asked the question on the decrease of the public sector inspection targets, which I've tried to explain that we had to accommodate the private sector institutions as well. How many ideal clinics have we certified between 2021 and 2023? This is information that we should be able to provide to the Health Portfolio Committee. At the moment, I'm not able to give the outright number, but we can go back to our data and determine how many of those institutions that are regarded as ideal clinics have been issued with compliance certificate. So this we can send to the Health Portfolio Committee later. The re-inspection, again, the percentage of re-inspected facilities that are compliant, the compliance rates, even at re-inspection, is still very low. And this is a huge concern to us. Yes, there are those institutions that actually do improve, but in the main, the compliance rate still remains low, even in those that have been re-inspected. Now, the other questions, I will refer the question on the compliance status of the 51 to Mr. Piri, who will address that. Then Honorable Wilson, most of the comments that you have made, Honorable Wilson, are equally our concerns. We do admit that there are serious challenges with the quality of services that are rendered. But let us also accept that over the years, at least when it comes to access to health services, we can agree that as a country, we've fairly done well in that most of our people can access services. What is a challenge that faces all of us, which requires our involvement and accountability as the Office of Health Standard Compliance, working in collaboration with all other stakeholders in the healthcare sector, is the improvement of the quality of the services. When we go into these health institutions to conduct these inspections, it becomes an activity of that particular time when you are in an institution. But when we talk about the quality of services, that should be something that health establishments are awake to every single day, and there are measures that are in place to ascertain that the services that are offered are actually of good quality. As a regulator, we will certainly do our bit in as far as ascertaining that there is compliance with the health standards. But it's also very important that all other stakeholders contribute towards this. And we do know that the National Department of Health has done a lot and is doing a lot with regards to the quality improvement initiatives. But as a country, we need to look at this as one activity by an entity feeding into another, so that at the end of the day, we can realize the overall outcomes, which would be the improvement in the quality of services. The mere existence of the OHSC indicates the commitment of government and of the country to ascertain that there is a regulator that is going to focus on the quality of services and the safety. Is it something that we're going to achieve overnight? Certainly not. Is it something that we will achieve alone as the office? Certainly not. But the fact that we do bring to the fore some of the challenges and the findings, it's then important that all that which we discover find expression in other ways and means, and it's constantly monitored. And it's for that reason that even when we provide feedback to the institutions, we always emphasize the importance of monitoring the compliance. And when we inspect, we look at a set of standards, but quality goes beyond the set of standards that we use to actually inspect the facilities. Yes, we're under-resourced, but it's important that we highlight that we have already put systems in place and we do have a regulatory framework that we follow as an entity. Once we have adequate resources, we should be able to see even more improvements. We also must accept that we come from a time where there was absolute resistance to the work of the OHSC. It took some time for the healthcare sector in its entirety to even understand and appreciate that the healthcare sector is going to be regulated. We're at a stage where we can comfortably say, generally people understand the role of the Office of Health Standard Compliance. But what then becomes our next task is also to emphasize and to educate the entire healthcare sector that it is not only dependent on the Office of Healthcare Health Standard to improve all the quality of services. It is going to be a concerted effort by everyone that is involved. Now, the question, how are we going to implement the NHI? And particularly those institutions that are non-compliant. Once again, we are at a stage where we have to start somewhere. And there will never be a time where the environment is so conducive that all the quality of service, all this, the services that are provided are of good quality and there's absolute safety. Now we can start the NHI. We should look at this as part of the progressive improvements that we should bring to the healthcare sector. And there will never be the most opportune time to start, but we have to start somewhere. And the work that we do will then contribute towards moving us to the level where we're able to say, we are now certainly starting to see improvements. Even when we look at other countries that have implemented universal health coverage, it took some time for them to get to those levels, and most of them are probably not even there. But as the office, we do commit that in as far as the regulatory environment is concerned, we'll certainly do our bit to take along the health establishments, both in the public and private sector, so that we understand the importance of the provision of quality services and safety, because in the end, that's what's going to improve our population health outcomes. Honorable Chirwa asked about the long-term plan that we have for human resources. We do have a revised organogram that is aligned to our operations based on the experience of the past 7 years. However, the biggest issue that we have is that most of the positions that are in our organogram at the moment remain unfunded, and that is a concern. Honorable Jacobs asked about the bulk of the budget in program 2. I will request the CFO to respond to that, and also inquired about the decrease in inspections in the public sector versus the private sector. And I think I have addressed that question with regards to us at least having to accommodate the private sector inspections. And now, when it comes to the number of unknown re-inspections, when we conduct routine inspections, it is impossible for us to know whether that health establishment would be compliant or non-compliant. Of course, we would like all of them to be compliant. But honorable members, it is correct that based on the non-compliance rate over the period, we can largely or roughly estimate that in the main, this is the percentage of re-inspections which we are supposed to conduct as an office. And we then use that figure, but it's, as I've said, that it's very difficult to plan because it's almost like an unknown, but definitely based on our data, we are able to determine. I'm going to request my colleague, Ms. Moliko, to address the inspection training question by Dr. J.
From my side, that I'm struggling like.
I'll also request Honorable Chair.
Yes, I seem to lose you in between. It's probably from my side.
Can you hear me now, Chair?
I can hear you now, yes. Maybe if you ask those who will answer, maybe to speed up a little bit. Thank you.
Okay, thank you, Chair. And lastly, it would be the CFO. So in that order, it would be Ms. Moliko, Mr. Phiri, Dr. Jacobs, Mr. Mapata. Thank you, Chair.
Good afternoon, honorable members, and thank you to Dr. Mdaweni. Just to respond on the question of training of inspectors, which was posed by Dr. Jacobs, to mention that in 2018, the OHSC had to outsource the services of inspector training. Firstly, the reason was that we didn't have capacity internally to train the inspectors. And secondly, the modules that were used to train the inspectors by the service provider, it was the modules that were presented to the board of OHSC for approval based on Section 80 of the National Health Act. And in terms of the training that was conducted, I must indicate that there were 8 modules and they were very comprehensive. And in the first cohort of training, it was in 2019, 60 participants were trained. And when I'm referring to participants, it's because even the assessors of the OHSC were trained because they also go and conduct investigations, including the employees from certification and enforcement unit. And following the training, the very same participants were certified by the CEO of the office, according to Section 82 of the Act, where it requires that the CEO must appoint the inspectors following attendance of a training, which at the end shows that they are competent in doing their work. And in 2021, 14 inspectors were trained by the University of Fort Hare. And I must also indicate that out of the 14 participants that were trained, they were also certified, appointed by the CO as inspectors. And currently, because the contract of the service provider has ended, we are internally discussing how to proceed with this, because at some point we need to make sure that we are also able to provide some of the modules internally to ensure that we are able to sustain and become efficient in the work that we are doing. And it's also based on the feedback that came from the inspectors, especially when it came to interpretation of the regulations and the inspection tools. Because as the CEO has mentioned, these are very, very technical and competency that needs people who have done this work. We have noticed that there are some of the modules that cannot be outsourced. They need to be delivered internally, but it will also depend on the resources. And I must also indicate that currently we don't have people that needs to undergo the training, because we also wait until there is a reasonable number of inspectors to be trained and investigators, so that we are also able to get value for the money that we'll be spending for training. Because whether you train 5 people or 10 people, then the cost will be the same in terms of the facilitators of the training. So basically, that is the reason why we had to outsource. And it was also informed by the previous feedback from the inspectors when we started. I will stop here, Dr. Mdaweni. Thank you.
Thank you, Ms. Moleko. If Mr. Piri and Dr. Jacobs could follow, then lastly would be the CFO, Mr. Mapata.
CEO, good afternoon, Chairperson and the honorable members, my colleagues also from OHSC and the board of OHSC. If I could respond to the question of how many private hospitals have not complied. But before I do that, maybe to give context, it's a report to be, for the facility to be declared compliant or none, it takes up to almost 60 days, where first then as an office, we inspect, and within 20 working days, then we report, and that report is preliminary. And the facility then is also then afforded 20 working days to go through our reports and respond to our findings. Then when the 20 working days is exhausted, then the office then have also then the opportunity to look at their response. Where we agree with them, then we change our findings and then issue the final report. Now, the number that I'm giving now is based on these 3 phases as to where the facilities at this stage are. Not all of the private hospitals are at the final stage of the report. Some we have just released preliminary report, or we are going to release them actually tomorrow. And some are at preliminary, which means that they are still considering our findings. And some have received their final reports. So at the moment, as we speak, they are sitting in those different phases, but we have a figure of
Am I the only one who's struggling?
I'm not sure if I'm not audible, Chair.
I can hear, Chair.
Dr. Mdaweni, am I the only one?
I can hear you, Chair. I'm not sure.
On my
If-
side, I can hear you, Chair.
Can I continue? Can I continue, Chair? Am I audible?
Yes.
We can hear you, Mr. Piri, but let's try and determine whether the chair can hear and maybe the rest of the members.
Thanks.
I
Thanks,
can hear
Stephen.
all is audible.
Honorable members, are we audible on your side?
Very clear to me, thank you.
Thank you. Mr. Piri, you
Yes.
can continue. Thank you.
Yes, I can confirm I could hear you.
Thank you, CEO. Thanks, honorable members. Yeah, I was saying at this moment, we inspected 51 private health establishment and 16 of them have not been compliant. So that's the figure that we have. 16 of them are not compliant at this stage, but like I was saying, they are in different stages. We might just have a different outcome once they submit their responses to us and we agree with them. So the figure can change at any given time as and when we closes their 20 days period. And with regard then of the other facility, the other financial years as to how many facilities has been compliant in 2021-22, we have inspected 544 health establishments and 177 were compliant. Similarly, in 2022-23 financial year, and that figure is bound to change also, we have inspected 781 of the public institution and 256 was found compliant, and that figure also might change because those health establishments also are on those three phases that I've just referred to. Thank you, CEO. I think those are the questions that you wanted me to respond to.
Thank you very much, Mr. Piri. Mr. Mapata?
Thank you, CEO. There was a question from the Honorable Chair, Dr. Jacobs, on Program 2 decrease in budget. Yes, there's a slight decrease of about 700,000, largely in line with also the reduced, slightly reduced target. But we should also indicate that the allocation in terms of traveling is determined by where the bulk of the facilities are located. For example, if most of them are in Gauteng, then the travel cost will be like a bit less than if they were in the Western Cape. But largely, we have ensured that the inspectorate still receives the highest budget allocation in terms of the MTF period. There was also a question by Honorable Gaba, I think also same question by Honorable Flag in terms of our projections. When we did the inspection business case, it indicated that at least 15,000 facilities are there. And from the NGOH side, they are of the view that the number is more than 50,000. I think they've also tasked the CSIR to assist with the quantification of the exact number. So based on the 15,000, we'll need to do about 3,700 facilities per annum so that it ties up with the validity of the compliance certificate, which is 4 years. And our estimate for that was around 350 million, based also on current staff on salary increases. And the other one was whether the vacancy is not filled. I think the CEO has addressed that one. I think those are the finance questions that, the last one was the point raised by Honorable Wilson on the 5% budget increase, that it is outdone by the current inflation rate. Yes, we agree with that the 5% increase is much lower than the inflation rate that is prevailing at the moment. And that's why we have raised that issue as part of the areas of concern. Thank you, CEO.
Thank you very much, Mr. Mapata. Honorable Chair and members, that would be our responses to the questions posed, and we also accept some of the comments and input made by the honorable members, unless if there's one or two that we have missed. Thank you, Chair.
Thank you very much. I don't think so. I'm also having, I think not just me, because I saw in the chat, others were also struggling to hear. So I think the system is getting tired. We've been at it all day. Thank you very much, Dr. Mdaweni. We appreciate the presentation and the open and frank answers to the questions and issues which were raised. And then it's just for Dr. Kenoshi maybe to give 30-second reply or anything he wishes to say, and then we will close our meeting. Just before we close our meeting, I'll make an announcement or two. Dr. Kenoshi?
Thank you very much, Chair, and thank you very much to you and the members, honorable members of the Portfolio Committee for having afforded us the opportunity to share with yourselves the 2023-2024 annual performance plan. We have noted the questions that were asked, and I think as we go on, I think they will also serve as guidance to us as board and executive managers in doing our work. But I think, Chair, let me just stop there and say that we will always be cooperating with yourselves, and we really enjoy the engagements that you allow us to have with yourselves. Thank you very much, Chair.
Thank you very much. Honorable members, just a reminder of tomorrow, and also the fact that we're having challenges at different times with load shedding. I see even my connectivity is making me struggle quite a bit towards the end. I'm not certain why that is really happening, but just a reminder for tomorrow. We're having, let me just, I wrote this down, tomorrow on the 19th, we're having NHLS at 10 o'clock in the morning. I see we've given 3 hours. We'll probably expedite this at 2 o'clock in the afternoon. So